The inner lining of the uterus is called endometrium. During every menstrual period, the inner lining of the uterus just sheds and a new cycle comes and the woman just has a new proliferated endometrium. When there is an irregular proliferation of this endometrial tissue, then polyp-like structures can happen. These are very common, like the 10 to 50% of reproductive age women can have endometrial polyps. These are easily detected by a transvaginal ultrasound in a routine examination. Women come with this endometrial polyps symptoms like in the mid-cycle spotting like bleeding or heavy bleeding or irregular bleeding. When your menstruation starts, it usually stops in 7 days, and up to the next cycle, up to the next period, you don't bleed. But if you're having a bleeding after the menstruation stops in the half of the cycle, then this is called mid-cycle bleeding. These spotting-like bleedings are usually one of the very common symptoms of endometrial polyps. If you're having an endometrial polyp, this is detected at the ultrasound. You can go the surgical removal procedure. But if the doctor is not sure about the endometrial polyp at the initial transvaginal ultrasound, then you can have a hysterosonography. This is a procedure easily done at the gynecological office room. The doctor puts in small catheter inside the uterus and gives some sterile saline solution into the uterus. This solution expands the inner lining of the uterus, so the ultrasound is much more visible. The endometrial polyp is much more visible at the ultrasound. If this doctor still cannot be sure about it, then you can have an MRI at the last session. But usually at the first and second steps, I told you before, is the detection of the endometrial polyp. When the endometrial polyp is detected, the doctor will offer you to have a surgical removal procedure because in rare cases, these endometrial polyps can be cancerous. So when the polyp is removed, it's sent to the pathology department for the analysis of the polyp. If the pathology is benign, no cancer, then you are safe. But if you are having an acute cancer in an endometrial polyp, then you should start your treatment of endometrial cancer. That's why this is important. Other than these problems like menstrual irregular bleedings or the risk of endometrial cancer, some patients come with endometrial polyps who are suffering from infertility. If the case is having infertility, that part of the uterus, the inner lining of the uterus, is the part where the embryos start growing. With endometrial polyp more than 2 cm in diameter, the baby cannot attach to that part, so it can be a cause of infertility. In such cases, we also do the surgical removal of the endometrial polyps. The removal procedure is done with hysteroscopy. Hysteroscopy is a modern technique to remove the endometrial polyps. It's a daily basis procedure. You come to the hospital in the morning. It's just 15 to 20 minutes procedure. It's done usually in the office or sometimes or usually in Turkey in operating rooms. The anesthesia will make you fall asleep with the IV line just for 15 minutes. Then the doctor, the gynecologist will go through the vagina into the uterus with 3 to 5 millimeter cameras and then see the inner lining of the uterus. The doctors remove the polyp from its base, which attaches to the uterus, and take it out and send it to the pathology. Then you wake up and you just have some 1-2 hours rest at your room. Then you can go home and there will be no pain, nothing you will feel after the surgery. It's very easy, but it should be done in certain indications. After the surgical removal with hysteroscopy for endometrial polyps, when you go home for 15 to 20 days, you might have some spotting-like bleeding. Sometimes bleeding starts, in few days it stops, it's the restart. So this is not a problem. This is a healing period. But at this time, after the surgery for 10 to 15 days, it's better not to have any sexual intercourse, not to have any infections. The doctors will give you some antibiotics, very simple antibiotics. You can use them for 5 days after the operation. And when the pathology result is received from the department, then the doctor will consult you with the certain results, so you will be treated completely.